Dr. Ashley Hendry. I was calling to get a quote for a self-pay patient to see what the global vaginal delivery fee would be.
If they're self-pay, they give them a package price, which would include the delivery and all of the services that they might need during the 9-month period.
You could give me the global, like the package price.
$5,730.37, and this is for a routine vaginal delivery with pre and post care in the hospital.
Okay, so does that cover like the hospital facility fee, or is that just the OBGYN group fee?
It is both. It includes all of it. And this is the self-pay package price discounted rate as of today's date.
What about an epidural? Do you have any idea what that is?
It doesn't separate it out. So I just can tell you that it is included.
And how much of a discount is that from the normal price?
That is the normal price. Ashley gives all self-pay patients that rate.
Oh, okay. Okay.
If you mean a normal price, it would depend on the insurance.
Oh, okay.
That is what any patient who doesn't have insurance would pay.
Okay. Is the insurance price usually more?
It depends on the insurance.
Do you know if they need to pay that full amount, like at the time of the delivery, or can they put that on a payment plan?
So they would be able to put it on a payment plan, and this is an estimate for cesarean delivery with 72 hours. $7,574.79, and that's as of today's date.
Okay, and that also includes hospital fee, everything, just a bulk package price.
Yes.
So for a self-pay vaginal delivery, it's $2,760, and they get a 20% discount off of that.
Does that include anesthesia or facility fees, or is that just like the global pregnancy package?
That is just for the global pregnancy package. The hospital is separate. There's usually another coder with me, but she just quit.
Oh no. And then as far as the vaginal delivery fee, does that need to be paid up front as well, or can they do that as a payment plan?
They can do that as a payment plan.
And what about for the cesarean section?
That one is $3,103, and you also get a 20% discount with that.
And is the 20% discount, is that just for self-pay, or is that for paying in full?
That is just for self-pay.
Okay. So the higher number is what is the charge if they have insurance?
If you have insurance and everything, it just depends what insurance you have.
And then do you have a ballpark about how much each prenatal care visit costs just to see the doctor without any testing?
And they also get 20%. If they're self-pay, they automatically get 20% off of everything.
Okay, I'm just calling around today to get some quotes because a lot of people are losing their insurance in January. And I have a cash pay clinic in Hattiesburg and Petal, so I appreciate you giving me some of those numbers.
Yes, ma'am, you're welcome.
How much is the epidural usually cash?
$1,071 after the self-pay discount.
Okay, how much is the self-pay discount?
Before is $1,500.
$1,500, okay. How much is the circumcision cash?
$600, and after the discount, is $250.
$250. And what about like an uncomplicated vaginal delivery?
The total is $5,840, and then with the self-pay discount is $2,244.
Okay. And does that include any of the hospital fees, or is that just purely the delivery itself?
No, that's just for the doctor fees here.
Then what's your price for the self-pay C-section?
Okay, before the discount is $6,450, and then with the discount is $2,448.
And then how do you guys do billing for all of the office visits for self-pay patients when they're pregnant?
They're set up on our arrangements with the delivery. All lab work and ultrasounds are billed out separately. And
Do you have like a ballpark for what like a normal OB visit costs cash?
For like our IPV, it would be $190, and that's not including the ultrasound. It'd probably be $289 without ultrasound.
So $289 with ultrasound.
Yes, ma'am.
And that's the initial prenatal visit? Okay.
Yes, ma'am.
Well, awesome. Thank you so much. I appreciate it.
No problem. You're welcome.